Well, here we are. Thank you very much for being here to join me as I share with you a little bit about integrated care. She said that, but I think she already gave my talk. So actually, I'm just going to talk to you about fruits and vegetables, if that's okay with you. Back in the day when I was at graduate school, I was administering some IQ tests when you happen upon one question. And that question is, how are a banana and an apple alike? How are they similar? Now, this is just a sample question, but the answer to this, as many of you well know, is that they are both fruit. Exactly. Thank you very much. They're fruit. And if you would have gotten that question right, you would have moved on to another question. Now, that question, though, brought to my mind a truism that many of you well know. And it's a truism that we've said many times before, but you can't compare apples and oranges. That's right. You can't compare apples and oranges. Apples and oranges are different. They provide different nutrients to our bodies in different ways. And yet we just talked about how two different fruits were similar. Now, I know what you're thinking. Dr. Rackham or Forrest, what do fruits have to do with integrated care or psychology for that matter? You're a clinical psychologist, aren't you? And yes, I am. You weren't supposed to see that slide. But one of the things that I noticed was that in integrated care, you'll have experienced a lot of things. Let me share with you a study that I often share with many of my own patients. Some researchers in the University of Sydney conducted an epidemiological study in which they administered fruits and vegetables to different people, or they saw how many fruits and vegetables they took in on a regular basis, and they compared it with distress. And what they found was that as fruit and vegetable consumption increased, distress decreased. Now, what's interesting about this is they actually defined distress as generalized anxiety and depression. So in a sense, as fruit and vegetable consumption increases, anxiety and depression decrease. We've heard in the past that fruit and vegetables are related to better physical health, and now we know that fruits and vegetables are related to better mental health. Now that's cool. Now going back to my experience at graduate school, as I was in graduate school, there was another thing that I became aware of, and many of you are pretty well aware of as well, but the medical field, wrong slide, but the medical field, going in the wrong direction, sorry. The medical field and the mental health field are different. You can't compare the two. And for many reasons, right here listed, there are many reasons why there are so many differences. But I want to highlight two. Those two are time and access to care. As you can see, when you go to see a primary care physician, you often will see them for about 15 minutes. When you see a mental health provider, you often will see them for about an hour. Also, access to care. In primary care settings, you will often be able to have almost immediate access to care. Whereas, when you go to mental health facilities or mental health settings, usually there's a long waiting list to get access to that care. And that doesn't seem fair. And what doesn't seem fair about that is that many people have to wait so long in order to be able to get mental health services. So people don't go to mental health services to get their care. Instead, they go to primary care settings. Now, this is important because I looked at a lot of different talks, and I found that generally around this time, that's when they start sharing some statistics. So I'm going to share some statistics with you. That's all the best talks. About 80% of all behavioral health, people with behavioral health disorders, will have visited a primary care setting at least one time in a calendar year. 50% of all behavioral health disorders are treated in primary care. 48% of all psychotropic medications are prescribed by non-psychiatric providers. I've had many times in which I've had some women that I've visited with that they say, I got my antidepressant from my OBGYN. People are not going to mental health settings to get their mental health services. They're going to primary care. And many of you might ask, well, why is that important to you? One word, mom. I guess Freud was right. Everything is about my mom. But maybe not in the way that he thought. My mom used to regale us with tales of different experiences that she had while she worked as a ward clerk at a medical facility. She was a champion of medical providers. She was willing to listen to what the medical providers had to say, take what they said, put it into practice at home. And she was able to be there to take care of our mental health and physical needs as I grew up. She was there with the medical providers as they set my bones in place, as they treated my ears for the multiple ear infections that I had. She was there also when they were stitching me back up from all the different careless mistakes that I made as a youth. In fact, I remember one time looking into her glasses and seeing the reflection in her glasses of medical providers stitching me up. I remember with intense interest, she was watching the whole procedure. She was a champion for medical providers. And I often viewed my mom as an equal partner with medical providers. That relationship changed, however, soon after she started developing pain from fibromyalgia and an injured neck from multiple car accidents that she had throughout the years. She went to the place that she trusted the most: primary care settings and medical providers. And after they did all that they could do to help her out with the best medicine that they had, they told her to go see a psychologist or a mental health provider. What she heard in her head was, it's all in your head. She felt discarded by primary care physicians who were only doing their job, trying to help her out. They knew what maybe she didn't know, which was that pain is both physical and emotional, and that oftentimes we only treat half of the problem, and that if we were able to treat the other half, my goodness, we can actually help people out a lot. But they didn't communicate that to her. And so because they didn't communicate that to her, she felt discarded. She no longer viewed herself as an equal partner and felt as if they had just left her out of the treatment decisions. As such, the providers didn't know what I knew. My mom was as vibrant as the vegetables that she fed me every day when I was growing up, even though I hated those vegetables. But those vegetables helped provide for my physical and mental health. I wanted the providers to see that too. And that's part of the reason why I went into behavioral health. I wanted to help empower other people in their own health care. I wanted to bridge that gap that my mom was experiencing between medical providers and patients through behavioral health services. This next slide was about my mom being a vegetable, but she's not a vegetable. She's as vibrant as those vegetables are that provide life. She's one of those missing ingredients that we often don't have in our lives, because as you know, many children will eat fruits, but they don't eat those vegetables. And yet, as we know, fruits and vegetables increased, anxiety and depression decreased. So, when I was in graduate school, I wanted to find a way in which I could be able to help bridge that gap, but I didn't know where I could go for that. I felt siloed. I felt as if I did not have any communication with the medical providers or the patients, and I didn't know how to bridge that gap. It wasn't until I went to internship that my supervisors introduced me to CFHA, or the Collaborative Family Healthcare Association. They are essentially America's test kitchen of integrated healthcare. They, along with a whole bunch of other organizations, clinicians, and patients, helped to develop different models of care. One of those models of care is referred to as the behavioral health primary care model. In that model, they equalize a lot of those things that we are talking about that are different so that we have more similarity. Of those two things that we mentioned earlier, time has been shortened for behavioral health providers so that they can keep pace with medical providers, so they can work as part of that treatment team. The other thing is that access to care has been changed so that they're in-house with the medical providers so they can have almost immediate access to care via warm handoffs. Now that's cool. So knowing that information and gleaning all that information from my supervisors, from CFHA, from the different things in which I was trained in rural settings, I talked to whoever would be willing to listen to me as I interviewed at Phelps Health. And I shared with them my passion and desire to be able to work in primary care settings. Now, I don't know if they knew what to do with me, so they set me up in 3 clinics, one in internal medicine, one in family medicine, and one in behavioral health. Which brings me to another experience that I had while I was there. I want to talk about another mother with another son with a different type of pain. As I was finishing up notes from one of the visits that I just had, I could hear uncontrollable crying from the exam room that one of my colleagues, my physician with whom I was working that day, just exited. And I went up to him and I asked, "What's going on? What's wrong? What can I do to help?" And he said, "Well, Forrest, this patient has panic attacks and they're uncontrollable. I'm going to have to send her to the emergency department to see if they can meet her needs." Now, knowing that that could be potentially a long and expensive visit for that patient, I asked the provider if he would be willing to let me step into the room with the patient and address her needs. So, in what we call warm handoff, he invited me into the room with him, introduced me to her, and told her that I help with anxiety and other healthcare needs. He specifically said, "Is it okay if Dr. Rackham visits with you about your panic attacks?" She agreed, and he left the room. In what transpired over about 30 minutes, I was able to visit with her. And in that visit, I recently learned that she had been told by another medical provider that the reason why she was not able to hear her toddler son was because she was having significant hearing loss. So as you can imagine, she was concerned. She did not want to miss out on many of the milestones that he was going to have throughout his development. So her mind went through a series of different events in which she began to catastrophize those thoughts and to think about the worst case scenarios. And as she did, she developed acute anxiety and panic attacks. Losing her hearing was traumatic for her. As we talked, I was able to find out that she really valued having a close relationship with her son. She wanted to have that bond strengthened. So we found ways in which we could help her practice relaxation strategies to bring down some of her stress. We're able to allow her to diminish her catastrophizing thoughts and get some emotional distance from those thoughts. And as we did that, she also was able to start accepting the thought that she may have some hearing loss, but it may not lead to total hearing loss. We also identified resources in the community that could help her out, including making sure she goes back to a different provider so that they could get her ears checked out more. The other thing that we also talked about, and we learned in that moment, was that she had been pushing away and ignoring her son. And that's not what she wanted. So we came up with different things that she could do to increase her ability to be both physically and mentally present for her son. And then she left. And then she came back 4 to 5 more times. And at the last visit, she reported to me that she was having a great relationship with her toddler son. She was enjoying her time with him. She had a hearing aid in her ear, and she had decreased her panic attacks to 0. And most importantly, she said she felt empowered. She felt as if she was part of a treatment team that valued her and valued the life-giving force that she was able to give to her children and to other people in her life. And that is not an isolated event. I've had many experiences like that as I've worked now in pediatrics and in other areas. To see people feel empowered, to see parents feel empowered to be able to parent their children in a constructive way in which their kids also feel empowered. So why do I, as a clinical psychologist, talk about fruits and vegetables? Because I'm concerned about the patient's whole health care. And I want to work as part of a treatment team with other people that know far more different things than I do, so we can collaborate with one another, so that in the future, you'll be able to go to any clinic, anywhere, and be able to have behavioral health physicians working with primary care physicians, nurses, and the most important ingredient of all, patients. So that as we work together, we can empower those patients and help them live a fuller, healthier life. Thank you.